Dr. Cable, call the operator.
Orthopedic spine surgeons and neurosurgeons working together to help you heal is the mission of the Norton Leatherman Spine Center. The team of world-renowned orthopedic spine surgeons and neurosurgeons make up the region's only multi-subspecialty practice providing state-of-the-art surgical care for serious spine conditions in children and adults. In this edition of Get Healthy, we take you inside the operating room to watch them work their magic. It's a busy afternoon in the surgical suites at Norton Hospital for Dr. Charles Crawford. It's his second surgical procedure of the day.
This is a lady who had a bad compression fracture and has sort of failed non-operative treatment. This has a lot of pain. We're planning on doing a kyphoplasty procedure on her. There's a lot of compression fractures in the country right now. The incidence of osteoporosis. With people living longer, you know, a lot of osteoporosis out there, a lot of people getting compression fractures. And the traditional treatment's just been treat people in braces and with pain medicines, and they were in pain for a few weeks, and then eventually, the pain would go away as the fracture healed, but people are trying to get back to their lives quicker, and this is actually a lady who's still working and is really anxious to get back to work. And so she wants the thing that will get her back to work the fastest. We had a long talk about all of her options, and this is what she wants to do. And I think it'll be a great thing. I think we'll be able to get her back to work quite a bit faster.
Dr. Crawford is one of the surgeons who make up the Norton Leatherman Spine Center.
I became interested in spine because I felt I was really interested in the anatomy of the spine. It's very complex anatomy. I like the interaction with the nervous system, the spinal cord, and the nerve roots. And I feel like it's a very challenging aspects of orthopedics.
He is part of a unique group in the region where orthopedic spine surgeons and neurosurgeons work together to help patients heal.
We can do really great things nowadays that are relatively new procedures with recent developments in instrumentation and different biologics, different imaging techniques that we have now with advanced CT and MRI. And I think our ability to care for patients with spinal disease is dramatically improved, and I think it will continue to improve in the future. And it's one of the reasons I wanted to be a part of this spine center here, is that I feel like we're really at the forefront of the current treatment, and we will continue to advance the treatment of spinal disorders. I consider all my partners, as well as the neurosurgeons that are part of this spine center, as some of the leaders in spine care throughout the country.
Today's procedure is a kyphoplasty, where surgeons inject a paste-like substance that hardens like cement into an area of the spine to stabilize it and alleviate pain.
One of the reasons we're able to handle such complex cases here is that we often work as co-surgeons with our neurosurgical colleagues, where they will perform parts of their surgery that they specialize in, dealing with decompressing the nerve roots and the spinal cord, and we will perform parts of the surgery that we, as orthopedic surgeons, have extensive training in instrumentation and bone grafting and fusion of the spine for stabilization. Working together, we're able to help each other both in the surgical planning process and the indications for surgery, which sometimes are the most difficult aspects of doing a surgery, is actually planning it well. And therefore we have two experienced surgeons with somewhat different backgrounds giving their opinions and coming to a consensus about what's best for the patient.
What's best for the patient, the most advanced technology available, and the expertise of some of the nation's leading specialists in spine and neurosurgery. Coming up, there's a new robot in town, and it's changing the way doctors do surgery.